So good afternoon, everyone. Thank you very much for those updates, Dr. Alexander Scott. As the director said, we are in a good place with our vaccine campaign. The biggest challenge we face right now is lack of supply. We are not getting a lot of vaccine here in Rhode Island as other states. We are still getting roughly about 14,000 doses a week, which is only enough to vaccinate 1.5% of the population of Rhode Island a week. Something that Dr. Alexander Scott shared last week that I really want to reiterate is that we would absolutely love to vaccinate all Rhode Islanders. That is our goal eventually. If we had enough vaccine today, we would do it today, but we just don't. But we're getting there. Older adults and healthcare providers are the two groups that we have started to vaccinate. However, even within these two groups, we cannot vaccinate everyone right away. That is why we have to take a stepwise approach. Could we please show the graph with these two population sizes? There are roughly 187,000 people in Rhode Island who are older than 65 years of age. If we were to say that all adults 65 years of age and older were eligible to get vaccinated right now, it would still take us months to get through this population, given that the 14,000 doses we are getting a week is just not enough. And that is even if we did not administer a single dose to other groups like healthcare providers and people that are at higher risk. So we are vaccinating older adults in a stepwise approach. We started vaccinating, as many people know, in nursing homes in December. This week, we're starting to vaccinate, very thrilled to say, in assisted living facilities and other congregate living settings. And by the middle of next month, we anticipate the vaccine will be available for adults 75 years of age and older. As the director said last week, it would not be honest or fair of us here at the Department of Health and the state to tell all people older than 65 years of age that they can be vaccinated today, because we just don't have that amount of vaccine, unfortunately, to support that kind of demand. In other states which have taken this approach, it has resulted in an enormous amount of confusion, frustration, including long lines and crowds, which we're obviously trying to avoid during this pandemic. The other example is healthcare providers. There are roughly 65,000 licensed healthcare providers in the state of Rhode Island. Healthcare providers are critical, my colleagues, critical to our response. We would absolutely love to vaccinate all healthcare providers right away, again, if we had enough vaccine. But with us getting only 14,000 doses a week, it would take us months to get through the healthcare population itself, even if we, again, did not administer a single dose to other populations, including older adults. That is, again, why we are taking a stepwise approach to vaccinating healthcare workers as well. We started with those at higher risk, those in the hospital setting. We then started vaccinating EMS professionals, and now we're working on outpatient healthcare providers, those in primary care, et cetera. We understand that there's a tremendous amount of demand for vaccine, and that's great. We love it. That's what we want to see. And we are trying to vaccinate as many people as quickly and efficiently as possible. But again, we just don't have enough vaccine to go around. And we're doing it in a stepwise approach, and it's really being driven by science and data, as well as guidance from the CDC and others. The aim of our Phase 1 vaccination program has been to ensure the stability of our healthcare system and protecting our long-term care facilities, as well as starting to vaccinate in some of our hardest-hit areas. Again, vaccinating our healthcare workers is critical given that they care for older folks, and we've seen in areas where the healthcare system has become overwhelmed that there's a mortality, that more people die because the healthcare system is not able to adequately respond. Moving forward, our vaccination campaign will be focused on protecting Rhode Islanders who are most vulnerable to severe illness with COVID-19. We are asking everyone for their patience just a little bit longer. We promise there will be vaccine for every person in Rhode Island who wants one in the future. In terms of the data on doses administered over the last week, we have been administering on average roughly 2,500 doses per day total, counting both first and second doses. That's an increase over the previous week when we were administering an average of 2,200 doses a day. Over the last 3 weeks, our number of total doses administered has increased from just over 10,000 to just over 15,000 to now over 17,000 for this last week. Even though we've only been getting 14,000 doses per week, we are going to be administering more than 14,000 doses a week because we're starting to administer second doses to some of the first people who were vaccinated. If we could please display the table with who's getting vaccinated this week, we'll give you some detail on who we're currently focusing on. Vaccinating is continuing to happen in hospitals this week. Many hospital workers are currently getting the second dose of their vaccine. Our regional clinics are still running for a number of populations, including pharmacists, laboratory professionals, college health services, staff at our alternative hospital sites, among other groups. I'm pleased to say that CVS and Walgreens have completed their first round of vaccinating this week at nursing homes and are now starting at assisted living facilities in Rhode Island. Approximately 10,000 doses have been administered to nursing home residents and staff during this first round. The pharmacies are going to go to all these facilities 3 times to make sure that folks have the ability to receive their recommended 2 doses of the vaccine. The assisted living facilities are Part B of the pharmacy's vaccinating plan, and it includes roughly 32,000 people. Many of them are older adults, including assisted living residents and staff, and people who live in elderly housing with residential services. Looking ahead to the week of January 25th, many of these same groups will continue to be vaccinated. The one big change is that outpatient healthcare providers will start to get vaccinated this week. Outpatient healthcare providers include primary care providers, dentists, pediatrician, etc., people who are at higher risk of acquiring COVID-19. Outpatient healthcare providers will be getting vaccinated at our regional clinics as well as some of our hospital sites as well. After outpatient healthcare providers get started, we're going to start next with a group of healthcare workers and people in congregate settings. That group includes people who work in dialysis centers, people who are involved in blood, organ, and tissue donations, funeral home workers, and adults in group homes for people with developmental disabilities. Once we get this segment going, we're going to look next to people who are age 75 years of age and older. Regarding that group, we are exploring a number of sites where vaccine can potentially be available to people older than 75. Those sites could include, still in development, but could include places like pharmacies, regional clinics, or senior centers. The Rhode Island Office of Healthy Aging has been a great partner in thinking how to make this work, so thank you to the staff working as part of that effort. In addition to our plans for adults 75 years and older, we are also finalizing plans for the next phase of our vaccination campaign. We will be presenting those plans to the Rhode Island COVID-19 Vaccine Subcommittee tomorrow morning to get their feedback. We anticipate having those plans finalized by next week, so stay tuned. The last thing I want to address today are a couple myths that have been circulating about COVID-19 vaccine. There have been people who've been suggesting on social media that COVID-19 vaccine somehow causes infertility. In fact, I was shopping at the grocery store the other day, and the cashier, when I was checking out, young lady, we started talking. She had seen me on TV. She mentioned that her main concern about getting COVID vaccine was infertility. So we chatted about that for a while, and I want to make it clear that there is zero scientific basis to this claim. And to be clear, this vaccine does not cause infertility. It does not cause a person to be sterile. There's been several national organizations that have come out by this. This is just categorically false. There's no evidence that COVID-19 vaccine causes increased risk of infertility, first or second trimester loss, stillbirth, congenital anomalies, or other congenital defects. I just wanted to be clear about that. This is one piece of misinformation out there. We're also hearing other things, such as that this vaccine could cause COVID-19 itself, and that this vaccine can cause or alter your DNA. And those are also categorically false misinformation. We understand that a lot of people have questions, which is great. Again, a lot of interest in this vaccine, which we are thrilled about. And a lot of people, of course, search online for answers. We just recommend that you please keep in mind to rely on trusted sources of information. Trusted sources include news organizations, which are great and have been established medical and public health organizations like the CDC. And of course, the best place to turn to is your primary care provider here in Rhode Island. And of course, here at the Department of Health, we follow evidence and data, especially related to these vaccines. If you want to get the latest from the Department of Health on our COVID-19 vaccination update, as well as frequently asked questions, you can sign up for our weekly email update. As the director shared, you can do that by going to c19vaccineri.org, c19vaccineri.org. So in closing, I do want to thank everyone again for their patience as we continue to roll out vaccines. We're getting there. There's certainly more to come.